Okay, for our last video, we're doing 18.3 part 2, where we're going to focus on the veins. And so a lot of these will be somewhat similar to the arteries as well. Some will be a little bit different, and so we'll talk about those. So we have the superior inferior vena cava, which are leading up to the heart. I'm going to start with superior vena cava, what comes off of that, and then work our way down. So we have the brachiocephalic branches, subclavian, right? Axillary. That's so far so good, right? We also have the internal and external jugular, which kind of run along parallel. It's like the equivalent to the carotids. From the axillary, though, coming back down over here, we have the cephalic and the brachialic. The cephalic one is the one that's probably a little bit strange, but it's coming near the head of the humerus. So if you can think ahead of the humerus for that one instead of like actual head. The brachial will break down into the basilic here. We have the median cubital, radial and ulnar is still there, but then we also have the median antebrachial, palmar venous arches, and digital. So there's a couple like different ones. The basilic and the median cubital are kind of new, and cephalic is new too. On the body side, right, coming down the trunk, right, we have hepatic, we have the renal and gonadal, the lumbar, right and left common iliac, which then branch into external and internal iliac, deep femoral and femoral, posterior and anterior tibial, and then down the medial side of the thigh we have the great saphenous, which we did not see in the artery side. And that's going to break into the small saphenous, which runs on the lateral side of the lower leg. We do see popliteal and fibular that we saw before, plantar venous arch, dorsal venous arch to feed the digits. So a lot of these are very similar in their names, just named for the region we find them in, with a couple exceptions like the basilic, median cubital, great saphenous, small saphenous, right? Those are ones that we haven't seen yet. If we look in the thoracic and abdominal region, right, we have the esophageal, we have the internal thoracic, and then the azygos, which runs down this way, kind of down back along the vertebra. The hemiazygos, which runs like to the side of that. The phrenic, which runs along the bottom side of the diaphragm. Adrenal, renal, gonadal, lumbar, all those ones again named very similar for the arteries that they are counterparts to. Same with the common iliac breaking into the internal and external iliac. So a lot of these again are very similar. To their arterial components or arterial counterparts. Right, like subclavian, the one big thing is that we break into axillary, which we do have that same name artery, but we also have the cephalic, which is almost like the humeral circumflex. It's very similar to that, except it's running down the head of the humerus. So if we look at what these guys are for, again, most of these we have at least an idea, right, because they're very similar to the ones we saw on the artery side. With the, I'm just going to point out the ones that are a bit different, like the azygos and the hemiazygos, which these ones are going to originate in the lumbar region. They're going to pass upward through the diaphragm to drain blood from the intercostals and whatnot. The hemiazygos is going to just complement the azygos in draining from the esophagus, the left intercostal veins, and then lead it back into that brachiocephalic vein. So like that's what they're going to lead into, the brachiocephalic or the superior vena cava, just draining what we see in like the blood that we see in the thoracic cavity. For the head and neck, we have the internal and external jugulars, which again are just the venous counterpart to the carotids. We also have the temporal vein and the axillary vein, again draining blood from those particular regions that they're named for. And so this is where we would see them, right? We see the internal jugular and the external jugular. This is going to lead to all those different, remember those sinuses. But we have the occipital, right? We have the facial, the maxillary, right? The temporal, right? So branching off into those to service those parts of the head. We do have the various sinuses. Again, those are just like slightly more open spaces. And those sinuses can then drain into these veins to bring blood back to the heart, because these are what's basically coming from like the brain area, right? Coming from the brain area, and that are receiving that CSF. They're going to absorb all the CSF that is like done for, right? So that it can be filtered right through like the kidneys. So it's just talking about those particular things. Again, all those sinuses are just like that enlarged vein. They're all involved in draining blood from the brain. They're all involved in like receiving the like cerebrospinal fluid that needs to be filtered, right? And that can be filtered as part of the blood when it gets down to like the kidneys. If we look at the veins in the upper limb, again, we have the subclavian branching into the axillary as well as the cephalic. We have the subscapular, which is just like below, right underneath the scapula. The brachial, which is running down the middle of the arm, and the basilic, which is running kind of more medial. The median cubital and cephalic continuing. Radial and ulna will just follow along their respective bones. Basilic is literally continuing on, right? It's like long, right? Running the whole length of the arm. And then the median antebrachial is running between the bones there. And then the palmar venous arches and digital. This is just our flow charts for those. So just showing how they drain. So as we are coming down, we're draining into superior vena cava. That's what's going to lead us to the heart. So everything's trying to lead in to that point there. So from the right vertebral, draining in the right external jugular, right internal jugular, draining into the right brachiocephalic, as well as the right upper limb, draining into the right subclavian, the right internal thoracic, all drain into the right brachiocephalic, which then brings to the superior vena cava. If we look at what's coming from the limb, that's what we have over on this side. So digital to the left and right left ulnar and radial to the left brachial. The median cubital and median antebrachial will drain into the left basilic and cephalic, all draining into left axillary to the left subclavian, left brachiocephalic, and then superior vena cava. And then from the chest, right, we have the right and left intercostals draining into the hemizygos and azygos, which then also drain from the esophageal into the mediastinal and then into the superior vena cava. So a lot going on here with the veins, but again, most of them are named you'll at least have an idea of where to start looking for them based on their regional terms. This is just that table describing what we were talking about. So again, you can pause here if you want to read through it. I'm not going to read through it for you, but it's here for you if you'd like it. If we look at what's coming from the lower end, I'm going to start with the external iliacs and then work our way in from the internal iliacs, but right and left external iliacs drain into the common iliac for their respective sides, and then the internal iliacs will pull blood from the superior gluteal veins, internal pudendal, obturator, and lateral sacral veins. So those will go into the internal iliacs, which then go into the common. And then up through the inferior vena cava, we're going to join up with the renal veins, the lumbar veins, the adrenal, gonadal, phrenic, and hepatic veins, all drain into that inferior vena cava up to the heart. So the bottom half is kind of, I feel like for the veins, is not as difficult as the head, neck, and arms. And again, this is just the same table. Again, I will use gonadal vein. I'm not going to give any model like a sex or anything unless it's overt, like very obvious, but generally I won't. I'll just say gonadal vein rather than ovarian or testicular, which is what we would name them if we knew what the sex was of the person. So again, if we're looking at what's serving the lower limbs, we have the external iliac, which is the primary one, serving the lower limb. The internal iliac is dealing with the gluteal, the lateral sacral, and the internal pudendal and the obturator, so we're not going to worry about that. External iliac becomes femoral. We have the femoral circumflex, which goes around the femur. The deep femoral goes down. We also have the great saphenous running along the medial side of the thigh and leg all the way down. We have the small saphenous that branches from that. We have the popliteal running in the back, right, running down the back of the knee. We also have the anterior and posterior tibial, anterior in the front, posterior in the back, fibular running along the back of the fibula, and then on the top of the foot, the dorsal venous arch, and on the bottom, the lateral plantar medial and plantar venous arch. And so this is just the nice clean chart for the lower limb, where we start from the bottom with the digital, we get into the plantar arch and the dorsal arch, we move up, we connect with and drain into the anterior and posterior tibial and fibular, which drain into popliteal, which drains into femoral, along with the small saphenous and the great saphenous, and the deep femoral, and then to the external iliac, and then up to the trunk. Again, this is another chart that you can look through if you want to get super detailed. I've already explained most of this and where they're found, and so I'm not going to read through a table to you. Again, most of these are named for their regions, so again, regional terms, super helpful in this part. But this is one we don't want to ignore. We do want to talk about it in some detail, and it's the hepatic portal system and the hepatic portal vein. So when we see the hepatic artery, this is going to be the artery that goes right to the liver, and then the superior mesenteric, this is what's going to the small intestine. This is where we're absorbing, right in this capillary bed, this is where we're absorbing all the nutrients from the food we eat, and then we're going to immediately, like using the hepatic portal vein, take that blood to the capillary bed to the liver, right? And we want this to go right to the liver because the liver is going to store some things away, so certain minerals and whatnot, vitamins we can store in the liver, excess carbs, right, that are broken down, we can absorb those with the liver and store them in the form of glycogen. Any toxins that came in, like if you go drinking, right, can be filtered out in the liver here. And then we drain the hepatic vein, right? Once we've been filtered, once we've been handled by the liver, we can go into the hepatic vein to go up to the vena cava, to the heart. So if we look at the veins that drain into the hepatic portal system, we talked about the superior mesenteric vein, but it also includes the inferior mesenteric, so all of the ones involved with the intestine, the splenic or splenic, the left gastric, right? These guys are going to drain into that hepatic portal vein. So really the main, like the big players with your digestive system are going to drain into this hepatic portal system. Again, the hepatic portal vein is like collecting all this blood from the digestive system. So when we absorb nutrients, water, all that kind of stuff, we can use the liver to store and filter it before it gets passed off to the rest of the body. And this is just a table that's just explaining that, again, what they're connecting to and where they're going. So like the splenic vein, right from the spleen, the stomach, the pancreas is going to go to the hepatic portal vein, gastric from the stomach to the hepatic portal vein, inferior mesenteric from the large intestine into the splenic, which will then go into hepatic portal vein, superior mesenteric from the small intestine and some parts of the large intestine to hepatic portal vein, and then the hepatic portal vein draining going through the lobes of the liver. Okay, last thing is development of the blood vessels in fetal circulation. So we'll talk about how blood vessels develop, and then how fetal circulation is a bit different from like a newborn or an infant. So with the fetal side, I'm not going to really worry about the development, quite honestly. Like, I'm not going to ask you about that. So don't worry about that so much. Read it out of interest, but don't worry about it so much. With the way that the fetal blood circulation looks, it's very different from even the newborn, right? And it really comes down to the fact that the fetus in utero is not breathing, right? It's not using the pulmonary circuit to oxygenate blood. And in fact, we actually have little ways to bypass the pulmonary circuit. So we have like the foramen ovale, which connects the atria. And when we look at the pulmonary trunk and artery, we have the ductus arteriosus that connects them. So everything's very mixed right here. As we come down the aorta, right, we're not oxygenated. We're going to come down and we're going to enter in to the umbilical arteries, which are deoxygenated by now. This is going to go through the umbilical cord to the placenta, which is where we'll get oxygen from. So we'll get it from the placenta, which connects to moms. We won't get into the details of like how that happens, but it's not a mixing of blood. This is like the baby's circulatory system is still separate from the mother's, but we oxygenate at that placenta. We then take oxygenated blood through the umbilical vein, right, which is in red here, which will then join up with the inferior vena cava, right, and then through the heart, again, deoxygenated. So we're getting oxygen, we're oxygenating the blood using the placenta, and so we have the umbilical arteries and veins to carry blood to and from the placenta. And keep a note, this is the other place where the coloring does not tell you anything, right? It does not, the coloring is not what you would expect, where in this case, the umbilical arteries are blue and the umbilical vein is red. That's not what you would expect. And again, that's the second reason why we do not use color to determine artery versus vein, because it has to do direction. Remember, arteries go away from the heart, veins go towards the heart. Coloration / oxygenation do not matter.